Now we will go towards the femoral canal. Okay, so the thigh is divided into three compartments. It has got an anterior compartment, the medial compartment, and the posterior compartment. Okay, so the thigh is divided into three compartments. Muscles that have dual nerve supply. You have got a pectineus, which has got a supply from the femoral and obturator nerve. You have got a adductor magnus, which has got a supply from the obturator and the tibial part of sciatic nerve. You have got a biceps femoris. It has got a supply from the tibial and common peroneal parts of the sciatic nerve. Okay. Now, the most important from the examination point of view is a femoral triangle. Okay, always there is a one question on this. Okay, now coming to the femoral triangle. It is a triangular depression located below the inguinal ligament in the upper one third in front of the thigh. Upper one third of the front of the thigh. So this triangular portion in the upper one third of the front of the thigh forms the femoral triangle. What are the boundaries? Boundary is formed by the medial. So this is a sartorius muscle. Okay, snake-like sartorius muscle is there laterally. So medial border of the sartorius. Medial it is formed by the adductor longus. So you remember SAL, S-A-L, sartorius and adductor longus. Okay, that forms this femoral triangle. Okay, between the sartorius and adductor longus, and above is you have this inguinal ligament. So below the inguinal ligament and between these two, sartorius and adductor longus, lies your femoral triangle. Then what is the uh, apex is present where the sartorius overlaps the adductor longus and the base is formed by the inguinal ligament. This is the base. Okay. Now, what is the roof of the triangle? It is formed by the skin, the superficial fascia with the superficial blood vessels and superficial inguinal lymph nodes and the deep fascia, that is the fascia lata. And in floor, you have got four muscles. Okay, you have got two pieces, iliopsoas, that is iliacus psoas, then pectineus and adductor longus. That is the medial boundary. So adductor longus and iliopsoas and pectineus. So these are the four muscles from lateral to medial: iliacus, psoas major, pectineus, and adductor longus. They are forming the floor. Now, what is the importance? When there is a stab injury at the apex of the femoral triangle, structures lying at the apex of the femoral triangle from above backwards are, you have got a femoral artery, femoral vein, profunda femoris vein, and profunda femoris artery. A stab injury at the apex of the femoral triangle may injure all of the above structures. Okay. Now, what are the contents of the femoral triangle? Contents of the femoral triangle, you have arteries, you have got vein, nerves, lymph nodes, and the fibrofatty tissue. Which artery? So arteries, femoral artery along with its branches. It will have the superficial branches as well as deep branches. Okay, so superficially you remember femoral artery along with its branches. Okay, superficial and deep branches. Then vein, femoral vein and its tributaries. Okay, then which superficial branches of the femoral artery? You have got a superficial epigastric, superficial circumflex iliac, superficial external pudendal. Deep branches of the femoral artery, that is deep external pudendal, profunda femoris, and its branches like lateral and medial circumflex femoral. Okay. Then veins, I just mentioned femoral vein and its tributaries. Nerves, femoral nerve and its branches, lateral cutaneous nerve of the thigh, and a femoral branch of genitofemoral nerve. Okay. So you have got this femoral nerve along with this lateral cutaneous nerve of the thigh, and here is the genital branch of femoral branch of genitofemoral nerve. Okay, so you have got a femoral branch of genitofemoral nerve, this femoral nerve as such, and this lateral cutaneous nerve of the thigh. Okay, so these are the nerves along with the lymph node, deep inguinal lymph nodes, and the fibrofatty tissue. So these are the contents of the femoral triangle. Okay, now another question they can ask you on the femoral sheath. Okay, formation and compartments and the contents of the femoral sheath. They can ask you the content of the this femoral sheath as such. Okay, so it is a funnel shaped fascial sheath that surrounds the upper part of the femoral vessels and also encloses the femoral canal. Okay, it is formed anteriorly by the fascia transversalis and posteriorly by the fascia iliaca. Okay, so this femoral sheath is formed anteriorly by the fascia transversalis and posteriorly by the fascia iliaca. Compartments, it is divided into three compartments. You have got a medial compartment, the middle compartment, and the lateral compartment. So the medial compartment is also called as femoral canal. It is filled with the loose areolar tissue and contain the lymph node. It contains the lymph node, that is the gland of Cloquet, which drains the glans penis or clitoris. This is the SBA which can be asked. Okay. So the contents of this particular femoral sheath, it is divided into three compartments. The medial compartment contains the gland of Cloquet along with the loose areal tissue. The intermediate compartment contains the femoral vein, and lateral compartment allows the passage of the femoral artery along with the femoral branch of the genitofemoral nerve. Okay, so these are the contents of the femoral sheath along with its compartment. Okay, so this can be asked as a single based answer question. Okay, so boundaries of the femoral canal, it is the funnel shaped medial compartment of the femoral sheath. Okay, so most medial compartment is the this. Okay, so that forms the femoral canal. Okay, femoral canal, it is the funnel shaped medial compartment of the femoral sheath. It is around 1.2 centimeter long. It contains the loose areolar tissue and lymph node, that is the deep inguinal lymph node of or Cloquet's lymph node. Its upper end opens towards the abdominal cavity and is bounded by the femoral ring. Boundaries of the femoral ring: laterally the femoral vein is there, medially there is a lacunar ligament, anteriorly there is a inguinal ligament, and posteriorly the pectineal line of the pubic bone. Femoral ring is closed above by the extraperitoneal tissue called femoral septum. Okay. What is the clinical significance? It is the femoral hernia. The femoral canal is a potential point of weakness through which the hernia can happen. Femoral hernia is more common in females because femoral canal is wider in females as the bony pelvis is wider in females and the femoral vessels are smaller in diameter. Femoral hernia is abnormal protrusion of the abdominal contents, that is the small intestine, through the femoral canal. That is the medial compartment of the femoral sheath. Okay, the herniated structure enters the canal through the femoral ring, then bulge anteriorly through the saphenous opening and bends superlaterally towards the inguinal ligament. Strangulation of the femoral hernia may occur due to the sharp, stiff boundaries of the femoral ring. Femoral hernia lies inferior and lateral to the pubic tubercle, while the inguinal hernia lies above and medial to the pubic tubercle. So this is also one of the things which you should remember. Femoral hernia lies lateral to the pubic tubercle and inferior to the pubic tubercle, while inguinal hernia lies above and medial to the pubic tubercle. Okay, so this location also you should remember. Difference between the femoral hernia and the inguinal hernia. You have also seen the difference between the indirect hernia, inguinal hernia, and the direct inguinal hernia. That is with respect to the inferior epigastric artery, and this is with respect to the pubic tubercle and their location. Okay. So femoral hernia has got a covering such as femoral septum, anterior wall of the femoral sheath, and the cribriform fascia. Then what is the clinical significance? So surgical reduction of the femoral hernia, when you want to do the surgical reduction, at that time you have to divide the lacunar ligament. The lacunar ligament has to be divided to relieve the strangulation. Care has to be taken to ligate the abnormal obturator artery, which may run along the lateral margin of the lacunar ligament. This abnormal obturator artery is nothing but the enlargement of the anastomosis between the pubic branches of the inferior epigastric artery and the pubic branch of obturator artery. Okay, so the inferior epigastric artery pubic branch and the obturator artery gives the pubic branches, and that causes the anastomosis that forms the abnormal obturator artery. It is in danger of being cut during the incision of the lacunar ligament, as it lies close to the medial border of the femoral ring along the lacunar ligament. This can cause severe bleeding. Okay, so that is why even the boundaries of this femoral canal you should know. Medially it is bounded by the lacunar ligament, where this abnormal obturator artery can come. Okay,